Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Phenobarbitone. Phenobarbitone is a potent drug and it is a long-acting anticonvulsant drug. Phenobarbitone is a GABA mimetic drug. It is the oldest anti-epileptic drug. It is a GABA mimetic drug. It is the oldest anti-epileptic drug. Then pharmacokinetics of phenobarbitone. So in the pharmacokinetics, the phenobarbitone is a well-absorbed drug. It is also a plasma protein bound. So it is a protein bound drug. This phenobarbitone is the most potent enzyme inducer. It is the most potent enzyme inducer. So even a single dose can induce the liver enzymes. So it is the most potent enzyme inducer. It is not metabolized, only a small part of it is oxidized and it is thus avoided in renal failure. Almost 13 grams of phenobarbitone is a fatal dose, is fatal. Even 13 grams of phenobarbitone is fatal. Then uses of phenobarbitone. Phenobarbitone can be used actually as a drug of choice in epilepsy in children. It can be used in epilepsy following the febrile seizures. After febrile seizures, the patient can develop epilepsy. In this phenobarbitone, it can cause hemolytic anemia. Neonatal jaundice is seen, especially because it is an enzyme inducer. It has hypnotic effects and also sedative effects are also seen. So it can be used for hypnotic and sedative withdrawal. It can be used for neonatal jaundice also, especially as an enzyme inducer. One important things about phenobarbitone are the contraindications. Phenobarbitone is not used in sedation because it itself causes sedation. It is not used in obstructive sleep apnea. It is not used in obstructive sleep apnea. It is contraindicated in case of metabolic acidosis. It is contraindicated in cardiopulmonary disorders, and it is also contraindicated in COPD. It is contraindicated in COPD, chronic obstructive pulmonary disease, asthma. Then it is also contraindicated in acute intermittent porphyria and also paradoxical excitation and seizures. If there is paradoxical excitation and seizures which occur due to any cause, even in these cases, this phenobarbitone is contraindicated. So phenobarbitone is contraindicated in seizures, obstructive sleep apnea, metabolic acidosis. It is contraindicated in cardiopulmonary disorders and uh, cardiopulmonary disorders and also chronic obstructive pulmonary disease, asthma, acute intermittent porphyria, paradoxical excitation and seizures. Because paradoxical excitation and seizures are also seen in uh, phenobarbitone. So if you give phenobarbitone in those patients, again the um, paradoxical excitation and seizures will be prolonged or precipitated.
thank you and thank you for watching.